All right, thanks for staying with us. The Joint Health Sector Unions, JOHESU, on Monday gave the federal government a 15-day ultimatum to resolve all disputes and meet the union's outstanding demands or face industrial action.
That's correct. JOHESU's national chairman, Comrade Josiah, accused the government of withholding April and May 2018 salaries of some union members that participated in the union's last strike. Other demands include the age-long struggle for recognition of consultancy cadre for eligible health workers and other astounding allowances. Of course, the comrades stated that the unions would be compelled to embark on strike if government failed to meet its demands by January 31st.
Well, that deadline has come and gone, Thursday, January the 31st. And the question is, what next? Well, joining us is a health sector trustee, Senior Staff Association of Universities, Research Institutes and Associated Institutes, Comrade Kehinde Adegoke. Good morning and thanks for joining us on TVC Breakfast.
Good morning.
Okay, well, maybe for the benefit of our viewers, you want to recap for us what the issues really are, especially the most important issues right now that made you give government this 15-day ultimatum that lapsed yesterday.
Okay. Like I've earlier said, the issue of salary withheld, unjustly withheld, that's May, the whole of May salary and 15 days April salary. And this was done. Okay, let me just
that's a salary of 1.5 months.
Yeah.
In April, May of last year, of 2018.
Exactly.
Okay.
Then the issue of the current salary that is yet to be adjusted.
That's CONHES.
CONHES, yes.
Okay.
Because we have two salary structures in the health sector, CONHES and COMENS. And between 2009 and 2017, COMES, which is the second salary structure, had been adjusted 3 times. So, and nothing has been done so far to CONHES.
Now, COMES, so that viewers can understand exactly what we're talking about, has to do with the salary structure of medical doctors.
Exactly.
Okay, and CONHES is that of other health workers, other health professionals, including midwives, nurses, and all of that. And of course,
who aren't doctors.
Who aren't doctors.
Who aren't doctors.
The medical doctors are not part of JOHESU.
No.
Okay.
No.
We needed to clarify that.
Okay. Then the issue of non-promotion of our members, some of our members in some institutions from CONHES 14 to 15, as provided for in the scheme of service gazetted by the Office of the Head of Service since 2001. This will be the 18th year. This is, in fact, precisely February 2001. Since February 2001, this is February 2019. 18 years after, we are still on it.
Now, the president of the Nigerian Medical Association, Professor Mike Ogrima, declared that JOHESU is illegal and should not be recognized. Is that what it is?
Well, he's talking what he doesn't know.
How do you mean?
JOHESU is a body of all registered trade union in the health sector. And if it's not a recognized body, it will not be entertained in court. I mean, the body will not be recognized in court. The body has been engaging government, and the body has appeared in court. Even the last industrial action, we suspended it because of court action. And if he doesn't know, he should know by now, at least.
So you would think he spoke out of mischief.
Exactly.
What you're saying is
he doesn't know what he's saying.
Okay.
Or maybe if he knows, he's just, trying to call a dog a bad name to hang it.
Now, JOHESU as a body, is it a registered body recognized by law?
Well,
it is of course, it is an amalgamation of
exactly
different registered unions.
Yeah.
Legally.
So it's a joint operation of registered unions.
Yes. But as a body in itself that has all of these associations, under it, is it registered?
It's not a registered body per se, but it's recognized because there's always a coming together of bodies.
So couldn't that have been the reason the
Why?
man said it's illegal because it's not registered, recognized by law?
You see, the issue is that you don't call a body illegal when provision is there in the law that bodies could come together to fight a common cause. So instead of this body come today, another body come tomorrow, this one declare an action today, another one declare tomorrow. If we have 5 bodies declaring an action at different time, how will it look? So it's better for the various duly registered bodies to come together and fight a common cause. And
it still doesn't seem to be working, because now you have a situation where the doctors are actually saying that if government goes ahead and meets your demands, especially the issue of reviewing of the salary or adjusting the salary structure, which you've been asking for since 2014, that this will be a threat to the entire health sector.
Well, I don't know how that should be a threat to the entire health structure. Doctors didn't employ other health professionals and workers, and they cannot dictate what others are paid. So they have no such power to dictate what others will be paid. Everybody begged to apply, and we all went to higher institutions and studied what we all like to study. And you see, what is happening in Nigeria is an aberration. Go to other developed world. Every professional in their right is well taken care of, and everybody enjoy their practice. And health services is a teamwork. Before things began to degenerate in Nigeria, it used to be one salary structure. It used to be one salary structure
for health workers and
doctors. Okay. Until 1985, when Decree 10 was made, that created a separate office, that created chief executive position for doctors and reduced the hospital administrators to director of admin. And practically the way they operate, they are like glorified clerk. And what we are saying is that all of this must stop. Healthcare service is a teamwork, and since the Olukoye Ransom Kuti of blessed memory, since he created a separate medical salary structure for doctors, there has not been peace in Nigeria health sector, and that team relationship has been lost. So if we are talking about effective healthcare delivery in Nigeria, one of the major bane is that there is no more team relationship. And is the separation of the salary structure that has created it. It's like our local adage we say, a hungry dog will not play with a dog that is satisfied. So you can't expect the same thing. We used to have the same entering point pre this Decree 10 of 1985 and medical salary structure separation from other salary structure in the health sector. And as long as this exists, there cannot be true team relationship.
All right. Now, the deadline given to government expired yesterday.
Yesterday night.
31st or
12 midnight
12
yesterday.
midnight. So what is the next line of action for your union now?
Well, we actually suspended the action and resumed work 1st of June as a result of action from court. And we have sensitized our members. We are ready, our members are ready, but the leadership, we are still consulting in order to just know that the moment we start, there is no going back. And we want to start with rallies.
Okay.
We want to protest. You know, you are beating a child. The Ministry of Health is beating a child, and you don't, and it's their fundamental human right to cry. When you beat a child, the child has rights to cry.
But in this case, is it the Ministry of Health or government, for that matter, that is beating the child and borrowing your
it's actually the Ministry of Health
expression, or is it the medical doctors
it's actually the Ministry of unfortunately,
don't you think what government is doing is, hold on, let me just land on this, that what government is doing is, you know, like they say, a house divided against itself really cannot achieve much, you know, because they are not standing together. Is this not further complicating the issues of resolving your demands in such a way that government will actually take you, you know, seriously and say, look, we need to address these issues? But how does government step in when you have a divided house? The doctors are saying one thing, that they're actually threatening government not to meet that particular demand of, you know,
but do you think what they are doing is right?
Yes.
If you are to be an employer, you employ me, you employ him, and then he wants to dictate what you pay me.
Yeah, it's not a matter of rightness, but are you, what is Johesu doing to actually bring the NMA on board, to actually have this face-to-face sit down to iron out what those issues are, so that you can actually speak with one voice?
You see, the issue is, like I've said earlier, you can't be friends unless we want to deceive ourselves. You can't be friends when you are eating and you don't want your neighbor to eat. There is no way we can be friends. And when you have already, you are threatening government and you are pretending to be my friend, I mean, how would that work? And government too needs to hear things clearly. The people representing government, they are misrepresenting government, because all they are saying to Buhari is that Johesu is asking for equality, which is not true.
So what are you asking for?
Well, you know, I've been here a number of times.
Oh yes, a number of times.
We say equity. Is equity the same thing as equality?
Okay. And if you do justice to A, do justice to B.
Exactly. And all they are telling Buhari is that we are asking for equality, which is not true.
All right.
And that is what NMA keeps saying. That is what Ministry of Health keeps saying. And the issue is, okay, now, we obey court order. The court says status quo ante, and that nobody should do anything to jeopardize peace. That was the instruction from court. We obey court order. We went back to work. But immediately we got back to work, the circular of no work, no pay came out. And
has that been
that is, of course, that's why our members have not collected their salary. And is that right? Is this how we are going to do democracy? Is that rule of law?
Now,
is government obeying rule of law? When court say status quo ante, that means everything should go back to how it was before the action started. We went back to normal. Government dished out circular and effected the circular.
All right, there is no doubt at all that the mass of the people will sympathize with you as far as the plights are concerned. But are you also concerned about how your strike, your action will affect the patients who go to the hospitals?
Well, that is one of the reasons. We are supposed to have started 12 midnight, but we say, okay, we are starting, but we are starting with protests. We are starting with rally. That is another way of expressing grievance. But by the time we do this for a while and we are not seeing positive response, definitely we are going to spark. But this tells you that we have been human enough. The ADR that was set up was supposed to be for 21 working days. It lasted for about 7 months, over 6 months, almost 7 months.
What's that?
The alternative dispute resolution set up by...
I needed to clarify that.
And a number of issues were settled there. It's just that I can't talk about the proceeding of ADR because I wasn't there. And the rule of engagement in ADR does not allow one to say anything as per the processes that happened there.
Okay.
So until industrial courts bring out the judgments of what has been agreed, and they can only bring out what has been agreed. What is not agreed, they cannot bring out. So
on a scale of 1 to 10,
yeah,
to what extent has government met your demands?
Well,
so
I
far?
cannot say,
You gave
because
government a 15-day ultimatum.
Yeah.
Are you saying within this 15 days that government has not called Johesu to have some kind,
there has not been any
discussion
meeting.
on
There
the way
has
forward?
not been. That has always been the culture. It's unfortunate. You will give ultimatum, they will wait until the dying minute. I won't be surprised if they say they are calling us for a meeting today or tomorrow, just to, so that they won't say what has government done since this ultimatum came to their table.
But are you also worried about the timing, because these are election times and government will be very concentrated on election matters and all of that? Aren't you worried that government may not, you may not get government's attention?
And
Well,
to add to that,
that would be unfortunate, because you see, it's not something that started today. We have been patient on our side. The court says status quo ante. We went back to work. We've been working. The ADR that's supposed to be for 21 working days lasted over 6 months. Have we not been patient? We've been patient, of course. And our members are not happy with us. Our members are insulting us every now and then. Johesu leadership, you are not serious. What is happening? What are you doing? This. And the feeling of our members is that if we don't do anything, the process in this country, money will just be spent, and then the next thing, the next song you'll be hearing, we are just coming back from election, we are spending money on this, and that will be, give us another 6 months, give us another 1 year. And like you said, we are in the same sector. A salary structure has been adjusted 3 times.
For the medical doctor.
For the medical doctor. That of Johesu member, not for once.
But can you give us the scale, the difference between that of the doctors and that of members of Johesu, so that we understand what we're talking about, the chasing between the two?
Now, when you look at it, duration of time in training, medicine spend 6 years with 1 year internship, that is housemanship. Why an average Johesu member will spend 5 years and 1 year internship. A difference of 1 year, does it amount to almost 3 times remuneration different? An average Johesu member, let's say a nurse, will earn about, at entry point, will earn about 120 something. Why an average NMA member will earn 300 and something. So can you see the ratio? Is it not almost ratio 1 to 3? Okay. So does 1 year difference in training amount to ratio 1 to 3? Is that equity? And we are not asking for equality. What we are asking for is equity.
But
and
why is it that
they keep misleading government that we are asking for equality? I'm sure if President Buhari is not watching this program, at least some of his aides will also be watching.
All right.
And I believe they should be able to tell him the truth. Okay, so that they should stop misleading him.
Thank you very much. Kehinde Adegoke is the Associated Institute of Medical
SATRA, that's Senior Staff Association
Senior Staff Association.
University Research Institute and Associated Institution.
Okay.
Immediate past trustee.
Thank you very much for joining us on. We hope the next time we see that these issues would have been resolved in a way that will make Johesu happy.
We pray so.
All right.
Thank you.